Good evening, ma'am. How are you doing today? I believe you are recovering from the fibroid surgical operation?
Oh yes. I am gradually recovering. I wish I knew earlier that it was fibroid. It couldn't have come to this point.
Well, you are right. Let me quickly share with you about some of the early signs of fibroids that women ignore. Imagine having a condition growing silently in your body. A condition that affects millions of women worldwide. Yet many women ignore the early signs until it becomes severe. That condition is uterine fibroids. The scary part? Many women actually experience the early symptoms, but dismiss them as normal menstrual issues. In this video, I will show you the early warning signs of fibroids many women ignore, and why you should never overlook them. What are fibroids? Fibroids are non-cancerous growths that develop in or around the uterus. They are extremely common, especially among women between 20 and 45 years old. Some women may have fibroids and not even know, while others may experience symptoms that affect their daily life, fertility, and overall health. The earlier they are detected, the easier they are to manage. Now let's look at the early warning signs many women ignore. 1. Heavy menstrual bleeding. One of the earliest signs of fibroids is unusually heavy periods. This may look like changing sanitary pads or tampons very frequently, periods lasting longer than 7 days, passing large blood clots. Many women simply assume they just have heavy periods. But persistent heavy bleeding may be a sign of uterine fibroids. 2. Severe menstrual pain. Menstrual cramps are common, but extreme pain that disrupts your normal activities is not normal. Fibroids can cause intense pelvic pain, lower back pain during menstruation, pressure in the lower abdomen. If your pain is getting worse every month, it may be a warning sign. 3. Frequent urination. Do you find yourself going to the bathroom more often than usual? Large fibroids can press against the bladder, making you feel the need to urinate frequently. Some women mistakenly think it is due to drinking too much water, a urinary infection. But sometimes, the real cause is fibroids pressing on the bladder. 4. Abdominal swelling or bloating. Some women notice their lower abdomen gradually becoming bigger. They may assume it is weight gain, it is just bloating, it is a digestive issue, but in some cases, fibroids can grow large enough to make the abdomen look like early pregnancy. 5. Pain during sex. Fibroids can sometimes cause discomfort or pain during intercourse. This happens when fibroids grow in certain areas of the uterus and create pressure or inflammation. Unfortunately, many women feel embarrassed to talk about this symptom, so it goes unnoticed. 6. Unexplained fatigue. Heavy menstrual bleeding caused by fibroids can lead to anemia. When the body loses too much blood, it may result in constant tiredness, weakness, dizziness. Many women treat the fatigue, but ignore the underlying cause. 7. Difficulty getting pregnant. In some cases, fibroids can interfere with fertility. They may block the fallopian tubes, change the shape of the uterus, affect implantation. Not all fibroids cause infertility, but it is an important factor to investigate. Who is more likely to develop fibroids? Risk factors include family history, hormonal imbalance, obesity, early menstruation. African ancestry studies show that black women tend to develop fibroids more frequently and at younger ages. When should you see a doctor? You should seek medical advice if you experience extremely heavy periods, severe pelvic pain, constant fatigue, frequent urination, abdominal swelling. Doctors usually diagnose fibroids using ultrasound scan. Final message. Fibroids are common, but ignoring the early signs can lead to serious complications. The good news is that early detection makes treatment easier and more effective. If you notice any of these symptoms, do not ignore them. Your health matters.
Wow, thank you, pharmacist. I really appreciate the lecture. I have learned my lessons already. I will do my best to pass this information to my female friends.
Okay, that will be very helpful. And to you watching this video, if you found this video helpful, like this video, drop a comment, share this video with someone who needs to see it, and don't forget to subscribe for more health education videos that could save lives. See you in my next video. Bye.